Will the secretary please call the roll?
Director Masuda Barnett.
Present.
Director Robinson is absent. Chair Sorrell.
Present.
And for the record, those directors also present. Director Harrington.
Present.
You have a quorum.
Thank you. The next regular meeting of the committee is scheduled for Thursday, November the 5th at 11:30 a.m. The next item is public testimony. As a reminder, written testimony will not be read into the record, but will be indicated in the official record of this meeting and posted to the website. Madam Secretary, do we have any speakers who provided or registered to provide in-person or virtual oral testimony or submitted written testimony?
We did not receive any registrations nor any written testimony.
All right, thank you. The minutes of the February 20th Human Resources Committee meeting were approved by the board in February, but they are being presented today for the committee's acceptance. Are there any corrections or revisions needed to be made to the minutes? Hearing none, I'd like to entertain a motion to accept item 3A, the Human Resource Committee meeting minutes for February 20th, 2026.
Second.
The motion has been made and seconded. Is there any discussion on the motion? All in favor?
Aye.
All opposed? The motion carries. The next item is the report from the Chief Human Resources Officer, which will be reviewed by Wynn Buren. Wynn?
Good morning.
Good morning.
Wynn Buren, Chief Human Resource Officer. Good morning, directors, chair. Thank you for your time today. What I have for you is our mid-year impact summary, a consolidated look at where Cook County Health stands on workforce metrics through the first half of FY26. I'll walk through demographics, our hiring and separation activity, the executive dashboard, and where we stand on nursing specifically, then hand it off to Karen and RJ for talent acquisition, and Janine and Carrie after that for workforce development. And I'll close things out at the end. So this slide here, as of July, we employed 6,658 employees, people across the system. The workforce continues to reflect the communities we serve, majority Black or African-American, majority female, and about 2/3 clinical, 1/3 non-clinical. Average tenure across the system is 10 years, which speaks to the mission-driven nature of the work. On the next slide, please. Turning to hiring and separations through the end of June, we made 1,187 offers this year, up from 1,133 last year, and external new hires up to 591 versus 579. Those are two numbers that show the hard work we're doing to bring people in, and we're ahead of last year on both. Total fill positions and net hires are down slightly, 776 versus 794, and 256 versus 268. Last year's numbers included a wave of agency to permanent conversions, employees already working here through an agency who moved onto our books. This year, the team is generating similar numbers through organic recruiting. Getting this close to last year's pace is hard work, and I want the recruitment team to get the credit for that. Separations are up about 8% year over year, 335 versus 311. Retirements are up about 18%, which is a sign of a workforce aging trend we track closely. Resignations are down slightly, so voluntary retention is holding. Discharges are up, so 50 versus 43, and more than 30 of those are tied to OIG investigations and the PPP loan fraud. Take out those separations this year, we're below 25, or we're below FY25, and net hires would be tracking ahead of last year's pace, so closer to 286 and 256. I also want to touch on agency, even though it's not on this slide. We presented it in detail at the Finance Committee, but it belongs in this conversation too. Agency staffing is down to 645 FTEs in June, 8.3% of our workforce down from a peak of 1,366 at 18.6% September of FY24. That's continued progress, and we're not done. We're working on another possible conversion effort with NNOC that would benefit our nursing staff directly. The executive dashboard slide. Now the executive dashboard, time to fill is reported quarterly. Overall, we're at 90 days against a goal of 90, or being under 90 actually. So we're essentially at target. For nursing, we're at 98 days this quarter against the 70-day national benchmark from the 2026 NSI report. That's above last quarter's 89. And as mentioned earlier, we're seeing some lag in hiring as hiring time as we distance ourselves from agency conversions, but we continue to improve processes and hold hiring first. So we're looking to see that number increase as the year continues. From a vacancy standpoint, 1,672 as of mid-June, so a 19.6% vacancy rate. That's a significant improvement from the 26.6% rate we had in February of last year. The one place that trend line ticked up was in December when we added 219 new positions to the budget. That's growth showing up as vacancy and not hiring slowdown. And it's worth clarifying if anyone asks about them. Next, oh, there we are. Nursing is the strongest story on this report. We've brought on 217 external direct care nurses year to date, up 78% from 122 at the same point last year. And our net RN hires are plus 137 compared to plus 5 in FY25, and separations are holding essentially flat, 80 this year versus 81 last year. So we're hiring significantly more nurses while losing about the same number we always do. So that combination is what we're actually changing our staff picture on the floor. So with that, I'm going to turn this over to Karen and RJ to walk through talent acquisition.
Good morning. So I'd like to begin with an overview of our FY26 hiring event strategy. In addition to hosting 5 Cook County Health hiring fairs across several nursing departments, talent acquisition also participated in more than 20 external recruitment events. Our outreach included partnerships with nursing associations, colleges and universities, workforce programs, and community organizations. These relationships help us reach a broader range of candidates, build longer-term talent pipelines, and increase awareness of career opportunities across Cook County Health. We are continuing that work through the remainder of the year with upcoming events, including targeted hiring fairs for Revenue Cycle and CERMAC Nursing, and participating in additional community career fairs and dedicated nursing and medical assistant recruitment events. Our goal simply is not to attend more events, but instead use targeted events and partnerships to connect qualified candidates with our most critical workforce needs. With the next slide, I'd like to highlight the measurable results of these efforts and the areas we are strengthening for FY27. From December 1st through July 30th, as a result of the 5 Cook County Health hiring fairs, we generated 208 offers and resulted in 124 external hires across Med-Surg, ED, patient care services, operating room, CERMAC, and JTTC. We also successfully onboarded more than 140 resident physicians, where the transition to electronic onboarding improved efficiency and the overall experience. This resulted in positive feedback from the graduate medical education department and the residents themselves. Also, with our accelerated hiring program, we continue to produce results there as well. Since December, we have had 157 candidates accept positions, 121 have already been onboarded, and 36 have upcoming start dates. Looking ahead, our FY27 focus is to build recruitment capacity through dedicated sourcing, recruitment marketing, and strengthening talent acquisition leadership. We are also working to streamline the candidate experience, expand talent pipelines, and provide targeted recruitment support to critical clinical and operational positions. Overall, these accomplishments reflect both immediate hiring progress and the continued development of a stronger recruitment infrastructure to support Cook County Health's future workforce needs. So we're encouraged by the progress to date and remain focused on turning expanded outreach and hiring activity into sustainable workforce pipelines and filled positions.
Thank you.
Thank you. And next slide.
Good morning. Carrie Pramick-Boak, Associate Chief Human Resource Officer. So this is our traditional turnover slide, which shows that we are still trending well below the national benchmark average. And this has historically been our story. We are still hovering at 8.9%, and we expect that that is not going to change throughout this year or even into 2027 based on our current turnover rates, and even with the increased separations because of all the increased hiring, we expect our numbers to stay pretty low. With that, I'm going to turn it over to Janine Sergey, our Director of Organization and Workforce Development, to take us through why our retention rates are so good and all the programs she's put in place to ensure low turnover rates.
So the next slide will show we've really taken a strategic, holistic, integrated approach. It's never just one thing. And you'll see the kind of key spots where it really is that 12-month onboarding process that we've put into play with all the different pieces that come into that. We also have leader onboarding now in a way that really helps set them up for success within the organization with all the different kind of resources and points of contact. I think with both these elements, it really is about those points of engagement that keep them connected, have a forum from which they're able to indicate if they're having any issues so we can proactively help them. And the fact that they know who to go to for what is so, so helpful. We also have BHR coming out with the leaders, and I think that's been a great shift and change as well to get them oriented right in the beginning of how to manage in a different kind of environment that we have. Then, of course, we have the whole focus on us as a learning organization. It's a strength and a history that we have as an organization, and so really honing into that, because that's so much of why so many people come and join us, for the opportunity to be able to keep developing. So we have a whole framework around leadership development, starting with the foundation of our leadership competency framework, and then building off programming for that. Just highlighting one piece, you in the board meeting, congratulations were given to our first 50 graduates from our 18-month frontline leadership program. Another 50 are going to be actually completing it this year, and there are other sessions ongoing as well. We have a whole build out of both manager training modules in bite-sized chunks, where it is very skills oriented in terms of what you can apply back with your teams, as well as leading self-training modules. And we're building out a real first aid kit for managers for kind of self-help pieces. Our workplace learning really goes to a vision that we have, that in this organization, we actually can see how competencies are framed out across all roles. And by the end of this year, we're going to have both a clinical and an operational competency framework developed out for 2 roles. And I think that will really help people see, what does that mean? How is it useful? And how can we utilize it? We've definitely seen that occur with our career learning pathways. We already have 9 career learning pathways mapped out for people, as well as we will have another 6. So we will have a total of 14. But in building out those pathways, we actually touch on 60 roles in CCH. And I can only say thank you to all our CCH staff who have been involved in building it out, because it really gives us a wealth of information of where we have gaps and what is not understood across the system. But also now what we have is going to be a resource for individuals to see what can they do with their careers at CCH. And when leaders are having conversations with their own staff, there's a meaningful conversation around their development plans. So that's really great. The other piece we want to speak to there is a huge focus on Microsoft trainings and getting people data literate. And Amanda Grasso's team has been doing a great job around Tableau, and she's involved with us with it, that we can look and say, it's not just about getting data points. How do we interpret them, and how do we tell the story that we can make informed decision making? So that's it's a whole shift. We're just bringing in some more advanced Excel training. We're finding we need that as the new function keys that people need to know how to utilize. And then how do we just have a welcoming, healthy CCH culture? You know, and I just came from actually organizing a critical incident group counseling session for a team here at CCH just even today. And I came off an engagement committee meeting where staff were saying, you know, we want to see that CCH cares when we have these traumas. And it was so wonderful to be able to see we actually have this in place, and yes, this is going on, and the appreciation that people mentioned. So really, it's something that we are really grateful for Cook County for, that they put in place for us. And then our whole move to one-on-one conversations and that impact that it's having in different areas throughout the organization, where we're linking performance to development. And you can see how every piece actually speaks to each other. I just chuckle because, I mean, I'm just going through that, and my morning involved so many of those pieces, not even including OD support, where I came off a session where looking at how to strategically position an area and how they need to be operating and what are they looking at and how they're looking at it in terms of giving the best results for CCH. So you can see in so many areas, how are we engaging our employees all the way around. So in our next slide, I wanted to really come into looking at a launch that we're doing here, which I'm so excited about, which is our life cycle surveys. So we are transitioning our exit survey, which is one of our life cycle surveys, from it being a link that gets sent out to a manager when someone resigns, that hopefully it gets to the employee and hopefully they fill it in. And now we're using Press Ganey as part of our contract with them, whereby it is automatically automated within our Oracle system. So they will, as their resignation gets kind of pressed, the button is pressed, they get their link to their survey. Okay. I'm also hoping that with it being a third party, the one, easier access and getting to the right people with the right timing, and two, that it's a third party framing the, you know, getting the survey results, that we will get even increased response rates, because that really helps with our ability to use it for informed decision making of any other moves that we need to make. Because even from the surveys that we did do, our whole 12-month onboarding process was because of that, the results that we were seeing. So I'm hoping for even better analytics. What I'm really excited about as well is being able to have automated systems using a mix. We only have an opportunity to use Press Ganey for a few other surveys, and we'll fill in the blanks. But I want a first week survey. We're doing a 30-day survey, 60-day, 90-day, 9-month, and 12-month, because that again means we can proactively work off the data that we're getting. And that's going to be launching as well in the beginning of September. So really exciting. Coupled with that, we've actually been working using our Salesforce system, been waiting for the communications, and now we have a means to get it out, that people are going to get communications when they join us over the entire 12 months with a really intentional campaign of helping them onboard easily, giving the links, the means by which they know what to do by when. So that poor risk management in Cook County don't get the calls on the 32nd day after they've joined us to say, how do we join up for benefits again? You know, because we've reminded them along the way, just making it easier for everyone. If we can bring ease in, it's going to be fundamental. If we look at the next slide, I just want to highlight a few other pieces that are not around engagement, but about pipelining. And these are new programs that we piloted and have had incredible success with. This is a program where we linked an ACHN clinic with a CPS school that has a health sciences elective, where students are going through a 3-year program already interested in healthcare, but embedding it so it's in the community and the kids come to the clinic. We had 9 student externs for our first, it's a full semester that they're there. They were exposed to 17 different roles, and 35 of the staff in the clinic were involved. And we didn't know how the staff would react. It has been overwhelming that they all said, oh, we're doing this again next year, because they got so much returns back and they saw what happened with these students. Just to give you some of the pieces to make it come alive for you, one student indicated that it confirmed that they'd chosen the right thing to go in. 2 students were not even aware that they could do healthcare outside of a hospital setting even, so that there were other variations. One student actually had never been exposed to behavioral health and now really wants, the social worker had such an impact on her that is now part of the studies that she's begun with this year. So we also had a student who remained on as an intern over the summer too. So the engagement and involvement, it's kind of that pipeline of prepping them that CCH is a home for them for their careers, but also that we're helping them with their decisions. And the impact is back in the school and back in the community, because the community is talking about what these students went through. It's been so successful that we've been able to extend this program in the first semester from January in 2027 to 4 different schools and 4 different clinics connected. And that whole setup is happening currently. If we look at the next slide, yeah, this is a program with our Applied Data Fellowship program. This was a bumper crop, is all I can say. Oh my gosh, we've got incredible fellows in a program that now we have surveys, check-ins, we do the whole wraparound. The work plans for these fellows are so directed that they are producing work for CCH that is useful and meaningful right away, as at the same time that they're extending their skill base, which is phenomenal. So much so that out of the 5, this again is a pipeline program, that 3 of the areas wanted to hire these fellows. With PIDs, only 1 has become available. And so with the preferred preference that can go to interns, they will be part of that selection process. And the fellows have been so loving being here. They've engaged with our mission, with what they're doing and the extension, that they've asked if they could extend. And the fellowship with the University of Chicago actually allows for a 2nd year. So we actually have 2 of them staying on for a 2nd year. And we've had our 3 new fellows start on Monday, and I'm just looking to another bumper crop. And they also got involved with doing a group assignment to learn collaboration, but also applying data, not just in the area that they came in, but seeing it across the organization. And they're busy developing for us a fundamentals of data analytics learning path that is an extension of our foundations of administration learning path that we have in play. So again, helping connect career learning pathways to actual learning programs. So we're looking to good thing. And again, Amanda Grass and her team are involved with us to take that even further. If we look at the next program that also, and the other cool thing that I have to mention is that the University of Chicago have asked if they can use the way that we framed out how we run the program as a prototype for every other institution because of the returns that we've got. All right, so the next one is another piece. If we can just go to the next slide. That's another new program we did. This actually started out with so many requests coming through for young students to go and shadow and observe that we wouldn't actually be able to operate and not impact patient care. And I remember speaking to Loyola University and saying, how do we do this? And I thought, an expo. And so we piloted this at Stroger. 18 departments were involved, 5 schools were involved. And again, the results were really stood the test. So much so that students understood that there's so much more that they can look at going into healthcare and getting jobs. And it's a career path that's a possibility. And we created learning plans for the teachers to use back as a school because we bring groups of students in. We are now going to be doing it at the Provident Hospital, our next expo, in the beginning of December. And we have now perfected the process. So we're going to have 14 schools involved with that piece. Yeah. CPS students, we had 6 interns this summer, which also landed up being incredible because they didn't only come with an idea of healthcare from being, say, a nurse or being a doctor. We had an IT student come in and had his mind blown by what Brian Prevel had done and mentored him with, of just what is possible, and he's going now to study with his IT with healthcare in mind, which is incredible. Another student came in, was going to be doing law and saw healthcare and law, and now he's actually going to be studying with healthcare administration because he can see the interface. So we're impacting these kids' lives with these programmings, and so it's really exciting to be a part of it. And the next slide, this is an initiative where we have got in partnership with the City Colleges of Chicago, and were awarded the Pritzker Foundation Talent Challenge Grant. And there we actually, I'll talk about the last bullet first. We're working also, Nick Shields is a key part of it, and we have an incredible project manager in Jasmine Sanchez. And we're having a launch in January of 2027, where MA medical assistant students will be actually studying for their certification at Providence Hospital. And once again, I think, I don't know about you, but I get kind of the things when I think of the history of Providence and we're bringing that learning back there. I think that's quite amazing. And the first cohort will go through and get their certification. The focus is then that their externships will happen within CCH. And then from an externship, we have obviously our really rigorous process for hiring that we go through. And so we launched this week, a medical assistant apprenticeship program. It is a 12-week program, which allows us to bring in apprentices, so folk who have just qualified with their certificates. They've done their learning. They've sat for the national exam, the exam that they get for their certification. They can't be hired by us yet. So we bring them in for advanced skills instruction. And so our providers have also been incredible with helping us identify, and Beth Vaklovic was also essential in this whole process, identifying what skills they still need that they're not being taught, things like Holter monitoring for cardiology, kidney biopsy assist, right, in nephrology, if I think I got that one right, please don't hit me if I get it wrong. Those kinds of elements we've included in, as well as we have added 26.5 hours of professional development for their employability skills. Things that we discovered when I was working with the students over at Malcolm X, and I have to give a shout out to Christine Zorga over there, who was instrumental with working with us as well, is that they don't even understand how to come out with a budget. Like, what happens when they get a salary for the first time? They don't know. So that is part of what we built into the programming, so that when they are employed, they actually can function in the best way possible and position themselves for their future careers. And I can categorically state we have one amazing group of 12 apprentices who have joined us. They are full of energy, full of life, full of curiosity, not scared to ask the difficult questions, and they are loving their experience. And the whole idea is we cannot obviously guarantee them a job, but we can give consideration for preference where we give to interns who have been with us or positions that are vacant. So it's a wonderful pipeline in. And what we've basically done is preparing amazing employees who come in already with a culture that we want embedded. So they have to display our always behaviors right from the get-go.
All right, and I think that brings us to the end of our workforce development slides, but we do have a final slide that Wynn is going to speak to about the loss of one of our team members.
Yeah, so before we wrap today, I want to take a moment. A lot of you know Dawn Brown from her work on these board presentations. If you've ever sat through one of these reports before, which I believe you all have, you know that it was clean, well organized, easy to follow, and that was the work that Dawn did. She built that. Dawn passed away on July 29th. Dawn gave 23 years to Cook County. She started as a personal analyst at Cook County Hospital, moved over to the Bureau of Human Resources in 2010, and came back to us in 2014 to run position control before becoming our HR project manager. In that role, she built and fine-tuned the hiring fair process, and this department still uses it today. That process was hers. Many of us attended her services this past weekend. Hearing the stories that people told, it was clear how many lives she touched, both personally and professionally. That reach went well beyond this building. I work with Dawn directly on that kind of material, the numbers, the notes, and the slides that you've seen trace back to the process she built, and she cared about getting it right, and that showed in everything she touched, and she will be missed by all of us. Thank you.
Thank you for your report, and thank you for your memory of her. That's a significant loss.
And that concludes our report. Happy to take any questions.
Want to say how outstanding the numbers were, especially the change in decreasing in the agency rates and the overall net hires, so that we're hopefully starting to get some headway over those that are resigning or retiring. I know that has been a concern. I know Director Robinson, who's not here, had mentioned that we were consistently not quite making the cutoff from those that we were hiring new on board versus those that were sunsetting. So we're now starting to get a handle on that, and increasing that has been a positive benefit.
I appreciate it, we are, and I failed to mention and recognize the work that Carrie and Tiffany Lopeman have done to help us reduce agency. They actually run a pretty tight ship. No agency comes on board right now without going through a committee that Carrie leads and Tiffany helps us process who comes through. So we wouldn't be at this number if it wasn't for the due diligence that they did in making sure that everything is vetted before we move forward with partnership with our BHR partners. So thank you to them.
It was mentioned financial, and again here how incredible that increase is. So we certainly want to point that out and highlight the improvements in agency rates. So great job.
Yeah, incredible work. Just want to echo what Chair Sorrell is saying. I think Director Harrington had elevated this before, and I know when we've talked about it in terms of the aging workforce. And I'm curious, like, how you all are monitoring kind of like age distribution with like number of years, like who can retire. Because I'm, you know, like, how are we anticipating those trends? So I was just curious, like, are we doing that now, and how are we doing that?
Yes, we have some numbers I can share. They're about, last time we ran the numbers, probably a month or two ago, there are 238 employees that are 60 years older with 30 to 39 years of service, right? And those are distributed through, probably 65 of those are in admin and clerical, nursing has 45, service and maintenance have 25, and the rest are distributed there. I think we've kind of identified the number. I think our next step is figuring out, all right, what do we do with those numbers? So we have the data, and now we've got to like work with the people to determine how we address it and how does that help us kind of workforce plan for the future there.
Okay, thank you. And then I just had, Janine, I love your passion and energy, such great work. I'm curious how we're thinking about engaging suburban cook, because all this work you're talking about is really set in the city of Chicago. I know there's institutions, it makes it a lot easier. You know, the suburban area is a little more complex, so I'm curious about how we're thinking about that.
So to be really honest, part of it is also about resourcing. I've just got so many folk, and how can I get them out there? So we thought about it when we moved to how many, say, of that ACHN health sciences space could we go to? And I only have 2 people, and it's time intensive. And so we said, let's spread it out here, and then in 2028, can we move into, you know, further in suburban? With the apprenticeship, we definitely looked at it, and I got to tell you, that's where we had some difficulty, because our selection process happens through Malcolm X. And we had to do something, because we've actually put apprentices out at Arlington High. And in different places, it's like, they can't get that. And I got like phone calls. It's 2 hours away from our home. I can't do it. So we really had to maneuver who can get that kind of experience. So we're going to have to be more creative of how we spread that out. I think with so many new programming, I wanted things a little bit closer to the center so we can control it, see how it works, tweak it, because I need everyone really confident in what they're doing, that they can go out when it's further away, and we can do it in a quicker, streamlined way. But yeah, point taken.
Do you need more assistance with the schools that are in the suburban area so that you can have, that'd been nice. I noticed you had a nice improvement in the pipeline as well too, from the year 1 through the section 2. You're adding 18 schools, I believe you said, for this.
We got 14 different schools. We're getting them around where because one of the things the schools say, they've got to be able to get to us quickly.
Okay.
So we identified 14 schools around Providence, and now at Stroger again, we'll do around that. But to your point, maybe our Career Expo, we need a traveling version.
Right.
Which is kind of what I'm thinking in terms of where you're going with that is another kind of option.
A traveling version, or perhaps suburban schools that have health care options as well too, so that you can link to them. So if there's a school in Arlington Heights that you can have a kind of a satellite clinic with, so that allows you to have students that are from Arlington Heights or placed out there, but a little bit closer location to be able to launch pad too if they need to.
Absolutely, for that particular program. Yeah, we're going to have to be creative around how we can manage it and support it.
And it's understandable that they start in the city area and spread out, but we want to see that spread to encompass the entire Cook County area.
Yeah.
And there may be a partnership with the Department of Public Health. They I just went to a celebration where they had trained a number of students on being community health workers.
That's one of our internships that they run.
Yes, and it was amazing. Similar outcomes, I think. Yeah. So just wanted to elevate
with Alicia Boyd, we know she was.
I know. I know.
But we love doing good grace for career progression.
Yeah.
So we have any other questions, Director?
No questions.
All right. Thank you so much for your presentation.
Thank you.
All right, the committee will not be going into closed session today, so if there are no other questions or matters to discuss, we can move to adjourning of the meeting. And I'd like to entertain a motion for adjourning.
So moved.
Again.
Okay. Motion has been made and seconded. All in favor?
Aye.
All opposed? The ayes have it, and the meeting is therefore adjourned. Thank you very much, everyone.